Well, this remarkable poster found by the Hearing Foundation actually provides a lot of description of the similarities that actually can occur in symptoms between Alzheimer's disease and untreated hearing loss, the first of our sections discussed in this part. But notice the correlations that exist there. Alzheimer's and untreated hearing loss have depression, anxiety, and feelings of disorientation in Alzheimer's or feelings of isolation. Certainly makes sense. Communication could be impaired, cognitive input is affected, and just down the list, right down to a distrust and suspicion in Alzheimer's and distrust and paranoia with untreated hearing losses. This is why it's an important factor to take into consideration. Okay, not sure what happened there, but we're good. So the importance of hearing really shows itself. Studies are showing such strong connections with hearing and vision loss to dementia. So how can people feel they can participate if they cannot hear, or perhaps, as we'll talk about later, cannot see what's happening very well? It really makes a difference in terms of promoting wellness by improving hearing and communication. This is straight out of your textbook, and it really talks about the functional consequences that can occur on that. But hearing really begins with the external ear, works through into the middle ear, and the result, a lot of times you see as a damaged effect to the auditory nervous system. Now, I encourage you to check this out in your book. But there are a number of age-related changes that can really affect hearing, and you just kind of notice here the different levels of sound that there are. Something as basic as mowing the lawn is actually in a damage zone, the very low part of it, but not that far from listening to rock music at a high level or hearing a jet take off. The intensity, the amplitude really can affect what occurs in terms of being able to hear, and then not hearing those types of things can actually be damaging as well. So there are a number of risk factors that really go into affecting hearing wellness. Listening to loud music at a younger age certainly has its effect. Hearing loss that's associated with lifestyle, to some degree heredity, I should say, environmental factors, medications, simply having impacted cerumen, earwax in the canal makes a difference there. In fact, that's considered the leading cause of hearing loss, which is really something that's preventable and treatable. And of course, different medications can have effects on hearing as well as some medical conditions. So in the terms of disease processes, you see the list is pretty lengthy of different things that can have an effect on hearing. So we need to look at the functional consequences that are affecting hearing wellness. There's conductive hearing loss, sensorial hearing loss, that's more in the inner ear, or a mixture of the two that can involve the conduction of the sound and the processing of the sound. The effect can sometimes be pretty detrimental for people, causing serious psychosocial consequences, including depression, social isolation, a decline in their cognitive function, and overall just a diminished quality of life, all because of presbycusis, decreased or lost hearing as a result of the sensorial hearing loss. A word I have difficulty saying. But the ability to hear high-pitched sounds can be lost, especially when there's background noise, which can make a big difference if you're out in large crowds or if there's a big family gathering. Another area that's a concern is tinnitus or tinnitus, which is the persistent sensation of ringing, or for some people it's roaring or blowing or buzzing, and it really can be a symptom of an underlying condition. It can be straight out from hearing loss. It can be from certain medications that are ototoxic. Remember, we've talked about furosemide already in the pharm class as being a major concern there. There are antibiotics that can also have potential ototoxic reactions. And that list of diseases that I showed you certainly can be a contributing factor. And these can be exacerbated with the use of caffeine, alcohol, or nicotine. So you as a nurse can actually perform a basic otoscopic examination for impacted cerumen and see if there is just packed earwax that needs to be removed there, and then seek additional orders for how to achieve that. The Weber and Rhine test, certainly you are learning in skills lab as tuning fork tests for hearing, and lots of different tools available, assessing the family history of it, and then looking at attitudes about hearing aids. Hearing aids, the old person's hearing aid is how that's perceived sometimes, when in fact, the loss of hearing is a greater concern for the older person than having to get hearing aids which have changed there. And take a look at one tool, for example, that helps you determine if there's a hearing loss. And different facilities will have different tools to help determine the probability of hearing impairment, and sometimes showing the person or the family member the relative degree of loss can make an impactful difference. But what do people see when they think of hearing aids? Well, the old horn is always what comes to mind, or something more like this, which becomes very unsightly to some people to see in their ears. But hearing aids have come certainly a long ways now, where the ability to have them with a thin tube and be out of sight and much smaller in size have taken place. So in terms of nursing diagnoses, you have to have somebody who's willing to look at improving their hearing issues, acknowledging that, yes, there is a problem, and have a readiness for enhanced communication. They could be experiencing anxiety about the issue, again, feeling like, oh, they're getting old. Or they could be experiencing impaired social interaction, which, as I've said several times now, can have an impact on the development and progression of certain types of dementia. They could be having difficulty with coping, loneliness, and certainly it does pose a risk for injury. Imagine not being able to hear the fire alarm going off because it's at a pitch that isn't being picked up anymore. So in planning for wellness outcomes, you're looking at improving communication, having more quality of life through improved social interactions, and making sure they're having a safer life as well. And safety is certainly one of the number one things we keep in mind for people for taking care of them. So promoting hearing wellness is really a key thing, knowing to make referrals appropriately to an audiologist who's qualified to make a judgment on that. And then if a hearing aid is recommended, doing the teaching process about the use and care of them, and making sure that they're getting put in is so key, making sure that they're using it. And how you can evaluate it, well, if their hearing was not well before then, but using them has shown improved communication, you've got an effective result there. And you'll see increased participation in social activities, appropriate ways that they're interacting with others, and overall an improved level of communication that's taking place. The same thing goes with visual impairments, because those have the real prospectus of affecting safety, functioning, and quality of life, much like the hearing losses there. There's a role of nurses in really recognizing that, hey, this person may have a vision loss and maybe doesn't realize it because it's developed slowly over a period of time. So you look at the eyes, they could have changes. Well, first off, changes occur as part of age-related changes. You see less tear production and certain amount of degenerative changes that take place all the way through the eye, the retinal neural pathway, and even going to the brain. The cornea can become more yellowed there. The lens might be stiffer and more opaque, and the iris becomes less flexible, all having impacts on vision that are part of age-related changes on vision. And these were some that are in your notes there, that some terms that you want to be familiar with there. Basically, all saying they're not seeing as clearly as they need to be. The risk factors for those that might be affecting that could include their own lifestyle that they run, the type of nutrition they're receiving, and maybe even the environment. People who smoke tend to have more visual difficulties if they're long-term smokers, as well as people who are out in the sun doing work, perhaps, but without any good eye protection, sunglasses a simple thing for that. And there could be chronic conditions and medication interactions that are affecting that as well. Changes that occur can be presbyopia, farsightedness, which diminishes their ability to focus on near objects. Imagine the difficulty reading simply because you could use a pair of reading glasses. And an important factor in vision for the older adult is they need generally 3 to 5 times more light than previously required after they reach a certain age, which varies from person to person. And this is why there's some difficulty with night driving. There's a potential for unsafe mobility and falls, especially with those middle-of-the-night bathroom trips that might be becoming more frequently. And this can result in anxiety, depression, and lower levels of psychological well-being as a result. You'll see cataracts sometimes, which is the leading but the reversible cause of vision impairment, age-related macular degeneration, glaucoma, and diabetic retinopathy for those who have a diabetic history. And especially important that Hispanic population is more at a higher risk of diabetic retinopathy. Taking a look at cataracts, cataracts are actually a graying, it comes over the lens, a clouding of the lens there, which can occur as early as people in their 40s, very mildly, and then keep worsening over a period of time. So cataract surgery is used to remove the clouded lens and replace it with a new artificial lens. So it is something that is correctable and makes a dramatic change in vision. Then there's age-related macular degeneration, the leading cause of severe vision loss in older adults. And 2 types to remember with that: dry macular degeneration, where the center of the retina deteriorates, and wet macular degeneration, where blood vessels basically leak that are growing under the retina. And a real key symptom of this is they start seeing some blurry vision until it gets to the point like it shows in this picture where the visual field is really affected. Things like certain vitamin and mineral treatments and surgery could be options to help resolve that. Then there's glaucoma, the second leading cause of blindness in the United States. Nutshell, it's too much pressure in the eye, too much fluid causing damage to the retina that could become permanent blindness, the second leading cause of blindness in the United States. So there are medications that can help reduce the pressure. And there's 2 types of glaucoma that can occur: open angle glaucoma, where you have patchy blind spots in peripheral or central vision, and acute angle closure glaucoma, where people get severe headaches, eye pain, nausea, vomiting, halos around the lights that are not related to certain medications, and eye redness. And like I said, if it's left untreated, it can result in permanent damage. Lastly, there's diabetic retinopathy, which is persistently high blood glucose levels, which inhibit blood flow to the retinal tissue, damaging and hemorrhaging the vessels underneath there, which results in partial or complete vision loss. And they may not even realize that they have it when they have diabetic retinopathy, but it becomes more apparent when the person sees the dark floating spots that look like kind of spider webs, kind of stringy sometimes, and they may experience patches of complete darkness and seem to have more watery eyes, and it's actually fluid leaking from the eyes. So real key there is to make sure that regular assessment of vision is being done through vision screening tests, and then be ready to work with your patient on their vision so that you can formulate the diagnosis, the readiness for enhanced knowledge regarding vision, and work with the same issues that you see with the hearing issues that we saw. And the plan is to get improved visual function and therefore have greater safety with your patient. So look at health promotion, teaching about that, getting people to recognize that there is help available, to seek out help, and to help improve their quality of life as a result. And then evaluating, is it doing its job? Our next section, we're going to be dealing briefly with sleeping.